Your skin instructor's tip of the week. When you're answering client questions, don't feel pressured to give the fastest answer, give the clearest one. Sometimes clients ask things like, can I shrink my pores? Or what's the best ingredient for acne? And the answer is not always a quick yes or no. As estheticians, our job is to slow the conversation down enough to educate, set realistic expectations, and help the client understand what is actually happening in their skin.
Welcome back to the Skin Instructors. I'm Morgan.
And I'm Jolie.
I love that tip of the week because sometimes we feel like we have to know everything instantly, but a confident provider is not someone who rushes through an answer.
Mm-mm.
A confident provider is someone who can say, let's talk through that and then explain it in a way that the client can actually understand.
Exactly. And that's what today's episode is all about. We're answering questions, we're talking through real things estheticians and clients ask, and we're probably going to have a little fun with it too.
Yeah, today's episode is a little different because we're doing a Q&A style episode and we have some skincare questions, some esthetician questions, some client communication questions, and we're also adding in a few personal questions because apparently people want to know who we are outside of talking about skin all day.
Which is funny because most of the time, even outside of work, we're still talking about skin.
Truly. But this episode's going to be a little more conversational. Some of these questions are listener submitted style questions. Some are questions we hear constantly in the treatment room, and some are just fun ones that we thought would be a good to answer.
Hmm. All right. Well, let's get into it.
All right. Okay. So starting strong, what skincare ingredient do you think is the most overrated?
I feel like this one can get controversial very quickly
Uh huh.
because a lot of ingredients aren't necessarily bad, they're just like overhyped. And so for me, I'd probably have to say collagen in topical skincare.
Yeah. Yeah, I agree with that.
Yeah.
Yeah, and topical collagen is just one of those ingredients that it sounds amazing to clients because they hear collagen and immediately think firming, lifting, anti-aging,
Yep.
plumping. But those collagen molecules are generally just too large to penetrate deeply enough to rebuild collagen in the dermis.
Yeah, exactly. And that doesn't mean it does nothing. It can be hydrating and it can support the feel of the skin
Hmm.
and it can be a nice moisturizing ingredient in a formula. But if a client is buying a collagen cream thinking it's going to replace lost dermal collagen, like that's where education is going to be important.
Yeah, that's a great example why estheticians just need to understand the ingredient function
Mhm.
versus marketing language.
Yeah.
Just because an ingredient sounds impressive doesn't mean it is actually doing what the client thinks it's doing.
Yeah. I know, and that's why I guess I also think hyaluronic acid can be a little overrated.
Oh, she said it.
Not because it's bad, but because it became this like universal answer to everything.
Right.
Dry skin, hyaluronic acid. Oily, hyaluronic acid. Barrier impaired, hyaluronic acid. And then aging, hyaluronic acid.
Yeah, it's a good ingredient, don't
Yeah.
get us wrong, but it's not always enough by itself.
Yeah.
If your skin is truly dry, impaired, inflamed, lacking lipids, HA is not gonna solve that.
Yeah, absolutely.
You need ingredients that are gonna help support your barrier. You need your occlusives, your emollients,
Hmm.
ceramides, fatty acids, and ingredients that are going to help prevent that transepidermal water loss.
Yep.
So I would lean more into ingredients that naturally boost HA versus just straight HA in a bottle.
Yeah. So our answer is not that these ingredients are bad, it's that they're sometimes marketed like they can do more than what they
Hmm.
actually can. Okay, so for question 2, this is a good one. What ingredient do you wish more estheticians understood?
I would say benzoyl peroxide.
That's a good one.
Yeah, I think benzoyl peroxide gets put into this category of being too harsh or too drying.
Mhm.
Um, and it can be
Mhm.
if you misuse it, but when you use it correctly, especially for inflammatory acne, it can be such an effective tool because it helps reduce that acne causing bacteria and inflammation.
Yeah, absolutely. And I think estheticians sometimes avoid it because they are worried about the irritation,
Hmm.
but that's where the education does come in. It's not just, "Hey, use a benzoyl peroxide." It's how often, what percentage, where in the routine, and what other ingredients are being used, and then how the client's barrier is going to respond.
Yeah, we love doing a timed schedule
Mhm.
with benzoyl peroxide and building up every 3 days,
Yeah,
and it works really, really well.
really well.
Yeah, and I would also say azelaic acid. I wish more estheticians understood how, versatile it is,
Mhm.
and it can be super, super helpful for acne-prone skin, but also, like, redness,
Mhm.
PIH, and sensitive skin too, when used appropriately.
Yeah. Azelaic acid's just one of those ingredients that doesn't always get the same attention as like retinoids and
Mhm.
vitamin C or acids, but it can be so valuable, especially when you're working with clients who are easily inflamed or prone to pigmentation.
Yeah. I feel like you have, like, a secret love for azelaic
I
acid.
do. I really
She's one of
do.
your favorites, isn't she?
She really is. I love it for so many different people and myself even.
You, like, kinda light up when you talk about
I
her.
do. That's funny.
Yeah, and, we don't want estheticians just memorize ingredient names, we really want them to understand what problem they're trying to solve.
Mhm.
Are we trying to reduce sebum? Are we reducing inflammation? Are we working on increasing, exfoliation and cell turnover? When you know the goal,
Mhm.
choosing the ingredients becomes more of a strategy.
Yeah.
All right, question number 3, the classic question. Can you shrink pores?
No, but kind of.
All right, that's the most esthetician answer I've
I
ever
know.
heard.
I know, but it's true. You cannot permanently change the actual size of a pore with a product. Pore size is influenced by genetics, oil production, skin elasticity, collagen, and aging. So when a client asks if you could shrink their pores, we need to clarify like what they're actually seeing.
Yeah, exactly. A pore can appear larger
Mhm.
if it's filled with oil, dead skin,
Yep.
makeup, debris, um, even oxidized sebum.
Mhm.
It can also look more noticeable when your skin's dehydrated and also when your collagen and elastin support around the pore starts to weaken.
Mhm. So, while we can't permanently erase pores or make them disappear, we can help minimize their appearance.
Hmm.
That might include consistent cleansing, exfoliation, retinoids, salicylic acid, professional treatments, oil control, and supporting collagen over time.
And I also love glycolic acid for
Yeah,
flattening those pillows.
absolutely.
So if you picture your pore surrounded by a big fluffy pillow around it, that's the skin around your pore.
Mhm.
Glycolic acid is going to compact those skin cells. So it flattens the pillow and then it makes your deep pore not look so deep.
Mhm. Yeah,
Nice little fun trick there.
I love that.
Yeah.
Okay, the next question is how often should clients get facials?
Well, depends on the goal.
Mhm.
Um, I know that's not a very exciting answer and a direct answer, but it's the truth.
Yeah, absolutely. For general maintenance, I usually think every 4 weeks is a good rhythm because it lines up well with the skin's natural renewal
Hmm.
cycle and it gives us a chance to maintain progress.
Yeah, yeah, and then if we're working on something more specific like acne or pigment, texture, whatever it is, that frequency is gonna be different.
Mhm.
An acne client may need to come in every 2 weeks
Yeah.
at first, depending on the treatment plan and how inflamed or congested the skin is, for example.
Mhm. And then for more corrective treatments like chemical peels, microneedling, lasers, or combination treatment plans, you're usually working in a series with a very specific time frame.
Yes, absolutely. Yeah, I think the mistake is giving a client the same answer. Um, like every single person that comes in, okay, see you in 4 weeks, see you in 4 weeks,
Yeah.
see you in 4 weeks.
Yeah.
Some clients need that monthly maintenance. Some need short term corrective series. Some need home care first before we can increase professional treatments.
Mhm.
So saying the same answer to everyone is just it's
Kinda dull.
it's not the best treatment
Yeah.
there. Your facial frequency should really match the skin goal.
Yeah. I
The
love that.
Yeah, it should also match what treatment we're performing, what their lifestyle is. Maybe if they bring up their budget, like that's always a factor.
Mhm.
Please don't get into their their
Their pocket.
wallet
Yeah.
before they invite you, but
Right.
yeah, there's lots of factors there.
Yeah.
All right, question number 5. What are your favorite treatments for acne?
Ooh, I personally love a good acne facial with extractions,
Mhm.
but I do think it has to be done thoughtfully.
Mhm.
Extractions can be helpful, but they're not the entire acne treatment plan.
Oh, yeah. Yeah, there's so much to consider when it comes to acne.
Mhm.
And I think clients just think we just extract everything, which, girl, I want to. Um, we're gonna extract everything and everything's gonna be fixed. But
Yeah.
acne is a chronic inflammatory skin condition, and the
Mhm.
visible breakout is only part of what's happening. There's so much more going on in the skin.
Yeah. Yeah, for me, I love treatments that combine proper exfoliation, calming inflammation, extractions when appropriate, and then LED therapy.
Mhm.
Blue light can be so supportive for acne prone skin, and then red light can be helpful when inflammation's present.
Yeah, I feel like there's not just one acne facial that's great for everyone with acne.
Yeah.
Like it really you have to figure out what's going on in the skin.
Yeah.
I love chemical peels for acne. Um Salicylic acid is great for controlling that
Mhm.
oily skin and congested skin. Um Adding in like a mandelic acid, that's a great peel option. But again, it just comes back to the assessment and what the skin needs.
Mhm. And then home care is everything because professional treatments help, but what the client does every day is going to be what matters
Yeah.
most. If their home care is stripping, clogging, inconsistent, or constantly changing because of TikTok recommendations, then we're going to have a really hard time making
Oh,
progress.
yeah. Yeah, especially with acne, and just make sure that you're focusing on the 3 main, points with acne. So we're reducing excess sebum, we're reducing inflammation, and we're increasing cell turnover. Those are
Hmm.
the 3, goals that we're focusing on without destroying the skin barrier.
Hmm. Alrighty. So number 6, what is one mistake new estheticians make?
I think I think one mistake that new estheticians make is just trying to prove to their clients that they know everything.
Hmm.
Um, instead of just focusing on what the client needs to know.
Yeah. No, I
Does
think
that
that's a
make
really good
sense?
point. Yeah, absolutely. I think that is a good point because then the client's going to leave confused instead
Yeah.
of like confident.
Yeah. Yeah, and I think when you're new, you wanna sound educated and that's fine.
Mhm.
That makes sense. You worked hard, you learned a lot, you're excited to be in the industry.
Yeah.
But sometimes when you're explaining something, it turns into, like, over explaining. You start throwing out too much technical language,
Yeah.
or you start to overwhelm the client, and, they don't need to know every single thing you know about skin.
Yeah, exactly. A consultation should not feel like a lecture.
Mhm.
It should feel like a conversation where the client understands what's going on and what matters most and what the next step is going to be.
Yeah.
So, I would say new estheticians sometimes want to fix everything in one appointment. They want to address acne, the pigment, the texture, the aging, the dryness, the redness, and the home care all at once in 1 hour.
Yeah. Yeah, for sure. I mean, you got into this industry to, like, help people. You're like, "I know all the things. I got you, girl."
Right.
Yeah, and what you're gonna end up doing is just overwhelming the skin or
Mhm.
overwhelming the client. So it's better to prioritize, like, what's the biggest concern? What is the skin ready for?
Mhm.
What can this client realistically commit to?
Yeah.
And then that's gonna build that long-term trust and the results.
Mhm.
All right, ready for the next question?
Yeah.
Okay, this is one of my favorite questions because so many estheticians struggle with this. How do you explain home care without sounding salesy?
Mm. The biggest shift is realizing that home care is not an upsell, it's a part of your treatment plan.
Yeah. Yeah.
Mhm.
We're educating the client. They came in looking for this.
Yeah.
So, if we treat the skin professionally and then send the client home without products, um, that's working against the goal here.
Mhm.
Or if you send them home with products and don't give them any guidance at all, we're really limiting their results.
Yeah.
So home care is how the client participates in their own progress.
Mhm. And I think the reason it feels salesy sometimes is because estheticians wait until the very end of the facial to bring it up, and then it feels like, "Okay, now that your service is over, here are products to buy."
Yeah. Yeah. Home care should really be woven into the entire appointment.
Mhm.
During the consultation, you're asking them what they're currently using.
Yep.
During the skin analysis, you're connecting what you see to what they're doing at home. And then during the actual treatment, you can explain why you're choosing certain products.
Yeah.
And then by the time you recommend products at the end, it should feel really, really natural.
Mhm. And I love using simple language, like, based on your goals, these are the products that are going to support what we worked on today.
Hmm.
That feels very different from just listing out the products.
Yeah. Yeah, and don't recommend 10 things at once, unless it makes sense
Mhm.
to, and the client's ready for that. Of course,
Yeah.
there's gonna be that person who wants all the things,
Right.
but sometimes the best home care recommendation is, your antioxidant, your retinoid, your SPF, and, a lovely cleanser, and
Mhm.
that's it.
Yeah.
Build from there.
Yeah, I agree. All right, next questions. Favorite skincare myths to debunk?
Favorite skincare myths to debunk? Um, this one really hit me hard when I figured it out, but oily skin, which I used to describe my skin as oily. Now
Yeah.
it's more normal to oily, but oily skin doesn't need moisturizer.
Yeah, that's a good one. That was mind-blowing
Yeah.
for me because I am very oily
I
up
fought
until
that for so
recently.
long personally.
Yeah.
I was like,
Like, why would
no.
I add it?
Why would I do that
I'm
to
already
myself?
greasy feeling. Yeah. Yeah, oily skin can be dehydrated, irritated, or barrier impaired
Yeah.
still. So skipping the moisturizer can sometimes make the skin feel even more, like, unbalanced.
Yeah. Yeah. Make it worse. Another one I would say is that acne is caused by being dirty.
Oh, yeah.
I hate that myth. I feel like it just adds so much shame. Like,
Yeah,
"Well, do you wash your face?"
right.
"Yeah,
Like,
Linda, I wash
yeah,
my face."
obviously. Like, acne is not a hygiene issue. It involves, like, that oil production, follicular keratinization, bacteria, inflammation, hormones, genetics, products, medications, and then even lifestyle
Yeah,
factors. So, there's just so many pieces to it
so
that
many.
it's not due to Poor hygiene.
Yeah. When I saw you get fired up about that one.
I know.
I would say another one is, stronger is always better. Stronger peels, stronger retinoids, more exfoliation, more
Yeah.
actives. Clients just think that if something burns or tingles or peels aggressively, it must be working. I am those
I
people.
was like, I used to do
I am those
that.
people.
Yeah. Yeah, but sometimes it is just causing inflammation.
It is, yeah. Results are gonna come from the right treatment at the right time,
Mhm.
not necessarily the most aggressive treatment every
Yeah.
time.
I also love debunking the idea that sunscreen is only needed when it's sunny out. Daily SPF matters because UV exposure is still happening even on the cloudy days
Mhm.
and through the windows and then during your everyday activities like going to the store and dropping the
Yeah,
kids off at school.
yeah. Alright, let's switch it up with a personal question. How did we get into aesthetics? You go first.
Yeah, I've had acne since I was probably 12 or 13. And then I was doing makeup, freelance makeup for a while before I decided to go to school and get my license. So I started out in cosmetology and I was like, I don't want to do hair and I don't want to do nails at all whatsoever, and transferred to an osteology program. And I was so happy I did it because I just love skin. And once I realized how much I like skin, I was like, I am done doing makeup.
That is
So,
so funny because, my story is kinda similar. I didn't go to cosmetology school, but I got it in my brain that I was gonna be a famous makeup artist.
oh, yeah.
Like, I am gonna do all of the celebrities' makeup. It's gonna be amazing.
Yeah.
So I'm like, "Okay, where do I go to learn how to do this?"
Mhm.
And I was like, "Huh, that's cool. There's, like, literally a school for aesthetics. Never heard of it."
Yeah.
Scheduled an appointment at local Aveda, and I fell in love with it. I was like, "This place is, like, so calming," and
Yep.
I loved it.
And the smell.
Like, yes, they knew what they were doing with that tour.
They really
I signed on the dotted line that day,
Aw.
and what's funny is I started and I was like, "Huh, I love everything about, this industry, but my least favorite thing about this industry was doing makeup."
Yeah.
I still will do it,
Once in
whatever,
a
like,
while, I do
every
it,
once in
yeah.
a while, but it's definitely not my passion.
It's
Isn't
not.
that funny?
I know, and I was kinda the same path, like, I was really big into YouTube back in the day, and I mean, to the point where I literally bought the whole setup and the ring light and the camera and the tripod and was gonna start filming
Oh,
makeup
wow.
videos.
Did you ever do one?
Yeah, I just never I did a few and I've never
I
posted
think you
them.
should post it.
No.
I think you should post it.
No, I don't even know where they're at now.
They're in
They're
there.
in the SD
The
memory.
they're in there somewhere. I love that.
Yeah. What is your favorite part about being an educator?
I love almost everything about being an educator, honestly, but I think what the best part is the light bulb moment.
Mhm.
You know what I'm talking about?
Yeah,
You're teaching and then, like, uh, your 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 student has been, like, trying so hard
yeah,
to figure something out, and then it just clicks.
yeah.
It's like a total confidence shift.
Yeah, I agree. I think that's such a good point because I love when someone says like, "Oh, that finally makes
Yeah,
sense."
yeah.
Especially with topics that can feel intimidating, like ingredients and acne, pigment, advanced treatments, or even electricity.
Yeah, and I love reminding estheticians that they don't have to know everything to
Yeah,
be good at it.
yeah.
You just gotta stay curious,
Mhm.
you know?
Yeah, I think that's so important. I mean, there's such a you see it all the time and I saw it all the time growing up with hairstylists that just kind of plateau with their
Mhm.
industry and they don't keep up on like the trends or the ingredients or the techniques or whatever. And
Yeah,
I think that's so true to any provider in the industry is, just stay curious.
yeah, absolutely. Alright, let's do rapid fire. Would you recommend
Okay.
segment. We'll answer quickly, but you know us, we're probably gonna
I know.
explain a little bit as
I
we
know, I
go.
don't feel like we're
Let's
capable of
try.
not.
Let's try. Would you recommend pore strips?
Usually no.
Yeah, same. I feel like they'll pull some oxidative or oxidized material, but they don't solve the problem.
Yeah,
Here we go. We're already
I
we're already
know.
chitty chatting.
Okay, would you recommend facial oils?
Depends on the skin and the oil.
Mhm. Yeah, they can be super helpful for some dry skin types, but they're not usually automatically right for every single person, especially some acne prone
Yeah,
clients.
but love me some jojoba.
Me too.
All right. Would you recommend slugging?
It depends. Yeah, it really depends.
You had to think about that one.
I did.
Yeah, I like for a dry compromise barrier, sure,
Mhm.
super helpful. Acne prone, congested, absolutely not. Do
Yeah,
not.
I
Like
agree.
I would not be happy slathering on something on my oily
Yeah, no,
acne.
no, I don't like that feeling.
No.
Would you recommend retinol for acne?
That's a duh. Yes, absolutely.
Yeah,
But I would tackle inflammation first.
I agree.
Yeah.
Yeah, I completely agree because while retinol can help with some inflammation, if your skin's super inflamed,
Mhm.
tackle that first, calm
Yeah.
that down. Retinoids can be super helpful for acne because they're going to support that cellular turnover. They're going to help prevent clogged pores and you just have to introduce them properly and protect the barrier.
Yeah. Okay. Would you recommend toothpaste on pimples?
No, but my mom would.
Listen, this is something I used to do in middle school, like before picture day.
Oh my god.
But that's one myth that we can leave in the past.
Yes, absolutely. Oh, would you recommend daily exfoliation?
Why did I say no?
No,
Depends on the exfoliation.
you had to think about that.
Yeah, because I'm like, duh, yeah, I'm gonna
Right.
exfoliate. But it depends.
Yeah.
And it depends on the skin condition too. There's a lot of factors there.
Yeah, the formula, the skin condition, absolutely.
Yeah. That's definitely not a yes or no answer.
Mhm,
Or question, I mean.
mhm.
All right, would you recommend popping pimples at home?
No, I wouldn't.
But we do. Yeah, it especially if you've got those deep inflamed,
Yeah, don't
lesions,
mess with them.
yeah, the risk is just too high. You're gonna cause some scarring.
Yeah,
It's like, just
just don't touch it.
learn from us.
Please
Just
don't
don't
touch
do
it.
it.
Yeah. Would you recommend SPF indoors?
That's a silly question. Of course, yes. Yeah, if you're near, windows or you're using actives, you're treating pigmentation,
Mhm.
or you're serious about prevention, like, absolutely.
Mm. Agreed, because also a lot of sunscreens protect against
Yeah,
HEV, so daily sunscreen is one of the easiest ways to protect results.
yeah, and prevent aging.
Mhm.
Alright, what's one thing that people would be surprised to know about you?
Yeah, I guess I would say, I don't know, maybe I'm pretty artistic, like, I love painting, I love anything to do with art. I do like some graphic design, very minimal, very little.
You are
Um,
very artsy.
but yeah, so
I
I'd say
love
maybe
it.
that.
Okay.
What about you?
Um, I'm a chicken and a duck mama.
True, true.
In a neighborhood, not even in the country.
Yeah.
They live on my tennis court, my reused tennis court. It's recycled, it's fine.
I love it. I'm ready for you to get a deer,
Oh, I feed all the deer in my neighborhood.
but you need a little.
Well, we did have a doe that decided to it was sleeping next to our tennis court, and I told Dustin to bring it inside, and he didn't listen to me, so I could have had a deer.
I would've been over there every day. Okay, last question. What is your favorite way to reset after a busy week?
Reset? Man, I wish I could say doing my laundry, but that's not it. Um,
That's not fun.
yeah, honestly, I this is after every day. I feel like I do a little reset. I just go home, take my bra off, put some jammies on, and I just go and sit outside and I watch Charlie
Oh,
Girl play.
oh, I love it.
Yeah. Yeah.
That's so
Hang
cute,
out with my
wholesome.
ducks,
Yeah,
my
of course. Your
chickens.
your chickens and my duck and your
Yeah.
ducks.
What about you?
Um, for me, I love Friday nights to myself. Morgan knows this.
She's
I
very protective of
I
these.
love my Friday nights. I come home and I'll like do a quick clean and then I will take a really long shower and then I do all the skincare things. So I'll exfoliate, I'll do a mask, maybe a sheet mask, I'll do my LED, I'll order takeout, watch a movie or like end the night reading a book. And
You have, like, mastered
yeah,
your Friday
yeah,
nights.
or I'll do my nails and watch a movie or catch up on a show, like, yeah, I those are my nights.
Self-care Fridays with
Yes.
Jolie.
So, they're my
I love
favorite,
it.
yeah.
I love it.
Okay, before we wrap up, let's give a little homework.
Alright. Yeah, so this week we want you to think about the questions you get asked most often in the treatment room and write down 3 of them.
Okay. Then then instead of just writing a quick answer, practice explaining everyone in a way that's clear, client-friendly, and realistic.
Yeah, so for example, if the question is, "Can I shrink my pores?" Don't just say no. Practice saying, "We can't permanently shrink your pores, but we can minimize how noticeable they are by keeping them clear, supporting the oil balance, and improving the skin around them."
Mhm. Or if the question is, do I really need home care? Practice explaining that home care is what supports the results between treatments.
Practice saying, "Yes, you silly goose. You need home care." The goal is to build your confidence before you're in the moment because when you already know how you want to explain something, you'll feel a lot more grounded when the client asks.
Mhm, mhm. Well, this was a fun episode.
Yes.
I love doing Q&As because these are the kind of conversations estheticians are actually having every single day.
All right. Yeah, absolutely. I think that what all of these questions show is that there's rarely a one size fits all answer in skincare. It really
Mhm,
depends on the client, it depends on their skin, their goal, their
mhm.
skin barrier, of course, and their expectations.
Yeah, and that's why education matters so much because the more that you understand, the better you're able to communicate that to your clients.
Absolutely. All right. Thanks so much for listening to the Skin Instructors. If you've loved this episode, make sure you share it with a fellow SD.
Yes.
Don't forget about our monthly subscription. It's on our website, www.sdtraining.com.
And as always, don't hesitate to educate.